Our stock of the day is Mesoblast. Its shares, well, they're flying this morning, are currently up around 15 or 16%. In fact, that's off the back of a US FDA granting cell therapy rare pediatric disease tag to treat rare heart condition. The cell therapy Revascor has the potential to treat a rare heart condition which primarily affects children. The company chief executive planning to meet with the FDA to accelerate the approval of the drug trial. If it's approved, Mesoblast may be eligible to receive a voucher for priority review of future drug applications. So big news there for Mesoblast. Luke, what do you make of the news and your outlook more broadly for the stock?
Look, it's tough to be too enthused about Mesoblast, Andrew, just because of the history of the business. I mean, it's a development stage biotech that's been around for many, many years and just really hasn't been able to find that one, big product or big breakthrough that sees the company, become a true business, I suppose, and not just a research company. As far as what they're doing with this drug, I mean, it sounds fantastic in the sense of, the FDA have a program to target, what they call orphan drugs, being, ones that don't have a large addressable market and may not attract, the medical attention they should, given those markets aren't as large from a commercial point of view. And it's fantastic that Mesoblast has this designation, hopefully gets the rapid approval, and the children around the world who suffer from the heart condition are able to, it's able to assist them in some way. But when you have a look at that from a business point of view, and that's what we're here today for, to talk about this as a business and as a stock, the business still burns an insane amount of cash. And as I said, for the greater purpose and the greater good of society, but as a stock, I'm happy to sit on the sidelines and let other people fund that. So I'd be staying away from Mesoblast, even on a nice little bounce today and a good announcement.
What has to change then? Obviously, get past this, get past those trials. I mean, what are you looking for?
Well, just commercial traction.
Yeah.
Some examples out there like Telix Pharmaceuticals, Neuron Pharmaceuticals. What's the other one that does the skin disease, Claude? It'll come to me in a second. But these guys,
maybe no.
No,
Clinuvel. Yeah.
Clinuvel. All examples of businesses that have taken a product through to commercialization, generated significant revenues and now profit. So, look, if you're there early, you obviously get a fantastic reward if they make it, but it's a massive risk, Andrew, and there's so many, for the ones that make it, so many don't. And so that's what you'd be looking for, just one of these products, and this may be it. You don't need a product that takes over the world. Clinuvel's product, has a small addressable market, but it's quite a lucrative niche, and they're dominating that as well. So that's what you'd be looking to change and see some real commercial traction with a product.
Yeah, such a hard sector to be in,
Sure.
and so much goes into it, not the least, of course, that cash you should talk about. Claude, what's your outlook?
Negative, always negative. It's funny, the share price is up today on the latest news. It has, they had a trial conducted in 19 children, a single intramyocardial administration of Revascor at the time of stage surgery resulted in the desired outcome of significantly larger increases in left ventricular end systolic and end diastolic volumes over 12 months compared to the controls as measured by 3D endocardiography. Now, I don't think many of the people rushing out to buy shares in Mesoblast today, pushing it up 30 cents, really have any idea of what this means for the value of the company, or if they're like me, even really what it means. But even assuming they know what that means, I don't think they know what it means for the company. And the funny thing was, the one article I've written about it was years ago now. Mesoblast Limited share price takes off on rampant speculation. And I feel like the same could apply today. So I encourage anyone to go back and read that one from a few years ago if they're interested in it. But, at that time, the exciting news was that the company reported that a trial of 12, so only 12 that time, ventilator-dependent COVID-19 patients saw 10 of those survive after being treated with 2 infusions of Mesoblast allogeneic cell therapy, Remestemcel-L, which actually might be the same thing as what they're talking about today. I'm not 100% sure on that. Remestemcel-L, no, this is Revascor, so maybe I'm not sure if that's just the new name of it or something, or if it's a different thing. But the point is, I think it is the same thing. So isn't that funny? Look, I think that history, might be repeating itself, but I would view it as a purely speculative stock for all the reasons that Luke said. And then within the realms of speculation, I would, there's many other speculations that I'd prefer over this one. Many.
Yeah, and as you well say, unless you've got a full understanding of what's going on there at a clinical point of view, it remains pretty opaque. So as you point out, that tends to make it fairly speculative. All right, so I'm taking it that that's an avoid from you as well.
Yeah, definite hard avoid.
Okay, all right.